when you graduate and it's time to, when you're graduating, I suppose, because you find out where you're going before you graduate, it's time to apply for intern years. You have a couple of choices to make, whether or not you're going to apply overseas. My cohort didn't really have that ability because we were here because of COVID, so none of us got overseas rotations or the appropriate letters of reference. So pretty much, I think almost every single person in my cohort stayed here. And I think I can think of 3 or 4 out of many who matched that year. I imagine it's going to be, those numbers will increase in the coming years, again, as overseas placements return. But I also don't know of anybody who tried to get an intern spot in Australia and failed to do so. There's strategy involved, obviously. So for me, would consider myself fairly risk adverse. So if there's a sure thing or something close to it, that's usually what I will pick. And I thought it was more valuable in my eyes from like a academic surgical pathway to be in the public system from the get-go, as opposed to trying to get into the private system for my intern year. So I opted to go to Rockhampton, which is a small city of 80,000 people, about 500 kilometers north of Brisbane. And I did my intern year there. Great, big learning experience. You know, there's a bit of this idea that's sold that there's a rural advantage. And I didn't really believe it as a med student because I just hadn't really been rural before, but I reckon it's true to a degree. When you're out there and you're short staffed, and you are expected to perform at a higher level. And I've talked to multiple consultants in a metro area who say that when they're picking people for, you know, PHO and registrar jobs down the line, they value having rural experience. There are other options, and I do know people who are Canadian who got metro spots in the public healthcare system as well. But it seemed like a big hassle. It seemed like the strategy essentially was just harass the people who were in charge of hiring every day until they say yes. And that seems stressful to me. I didn't want to do it. I think also if you go rural, you're more likely to get the terms that you wanted. So I went to Rocky and explicitly said to them, I want as much surgery as you can give me. And I ended up getting 2 full terms of orthopedics and a general surgery term. So very happy with that. Anything else?
Can you touch on what your position is now?
Oh, yeah, sure. So I'm currently at the Sunshine Coast University Hospital. I work as a senior house officer in the Department of Orthopedics. Great gig. I feel very lucky to have it. It's you know, there's only, I think, like 2 positions in Queensland for a full year ortho SHO job that are available to second years like myself. So very fortunate to have landed one of them. Most of my day looks like I hold the on-call phone. And so I see consult mostly in emergency, but we also get calls from peripheral hospitals and GPs and also inpatient teams. And I'll go and see patients, examine them, do like the workup from the orthopedic perspective, and then usually run my plan by one of the PHOs, one of the regs on call, just so I don't look silly in front of the bosses. And then when I have a plan, I'll go to the boss and I'll say, this is what it is. This is what I think we should do. And I have a pretty good batting average. I don't want to put a number on it, but so far it's been getting better throughout the year, I would say. I also spend a decent amount of time in fracture clinic, just, you know, reviewing patients and, who have non-acute injuries down the line. And I'm usually in operating theater. Like I would say probably an average of 2 or 3 cases a week, something like that. We're starting to get me to do stuff on my own now. So it's like I put in metal for the first time, like on my own, with supervision, but like without someone like telling me what to do, about a month ago. So that was pretty cool. So yeah, really, really happy about it.